Okay, so there is the first question. The first question is, who can take up these courses in clinical research? See, clinical research course itself or clinical research jobs itself are very much healthcare professional courses, and these all jobs only the healthcare professionals like HCPs can work. So the answer for this question is either you have to have a B Pharm or a M Pharm or a PharmD, or BSc or MSc or BTech Biotech or MTech Biotech, or any of the PhDs you can do it. And including BDS, MDS, BPT and MPT people can join these courses. So now these are the different qualifications. Any one of these people can join the courses. B Pharm, M Pharm, PharmD, BDS, MDS, PhD, BSc, MSc, BTech Biotech, MTech Biotech, BPT, BSc Nursing, any of the healthcare professionals can get into this kind of jobs. Enough. I hope my first question is answered. So the second question, how do I know if the course is right choice for me? See, now there are different courses which we have. So say, for example, clinical operation, and then clinical data management, and then PV, then medical writing. Then you have your SAS, and then you have your regulatory affairs. Now, first of all, the clinical operations. So all qualification which I said. So you can have a B Pharm, or you can have M Pharm, or you can have PharmD, you can have BSc, you can have MSc, you can have PhD, or you can have nursing, or you can have BPT, or you can have medical, or you can have dental. All these people can do this kind of a jobs, which is clinical operations like CRA and CRC. Jobs can be worked by all these people. There is no particular people that only these people will be taken into this career, but more B Pharm, M Pharm, PharmD, BSc, MSc, PhDs, nursing, physiotherapy, medical and dental doctors will be taken into consideration for clinical operation jobs like CRC or CRA or project manager or TMF. So this is about your clinical operations. Now, most important one, next one, everyone wants to ask questions saying that what is the qualification for CDM? Who can take CDM? See, everyone can take CDM, but most of times, it will be your BScs and MScs and BTechs, Biotechs and MTech Biotech people more prefer for this particular jobs, because they have more opportunities in CDM. The BScs and MScs and BTech Biotechs and MTech Biotechs, people will take this as an opportunity because they can take jobs of this kind of activities. So that's why BScs and MScs and PhDs and nursing people and BPT people go into clinical data management, CDM. This is a particular one. So now, but PV, when you come for a PV, so generally they don't take BScs and MScs, but rest of all qualification people they take. So for pharmacovigilance, they take only the B Pharms, M Pharms, PharmDs. They don't take BScs or MScs, but they take PhDs, nursing, BPT, and medical and dental. So now, if you are from life science graduate, then I would not suggest you for pharmacovigilance. I would not suggest you for pharmacovigilance. Now, medical writing. So this is more important for medical writing, that what courses you would like to take is, or what qualification you should have is MPharm or PharmD or PhD or medical or dental. So these are the people who can take admission into medical writing. So medical writing is specific for PGs. So if you are a UG, if you are an undergraduate, then I would not suggest you the medical writing. So I would suggest you rather go for further education and then take it up. Next one is SAS. Now, particularly SAS, I would suggest statistics people or maths people or data science people. So these three qualifications are more important, but sometimes they might take pharmacist, or life sciences graduate. Sometimes, very rarely. So I would not suggest statistical analysis because it's more of statistics. So you need to have a very big qualification of statistics. Then only you will be able to get the jobs in the SAS, or else you will not get the job in the SAS. The next one is regulatory affairs. Now, regulatory affairs, every qualification, including BPharm, MPharm, PharmD, BScs, MScs, and BPTs, nursing, dental, everyone can work. There is no specific requirement for the qualification in regulatory affairs. So now these are the different courses which you can take it up. So the first question, which are the people who can take it up? So it's BPharm, MPharm, PharmD, MScs, BScs, PhDs, and nursing and BPTs and medical and dental people can take the admission into the courses of clinical research. The second one, which course suits me? What course suits me? And also your interest also should be more important. Say, for example, you are good at medical writing, you can go for medical writing opportunities. You are good at analysis, you can think about CDM or SAS. You are good at safety, then you can think about pharmacovigilance. So now this is something which is your second question answer. So I'll park here for a minute, and if there is any questions, I'll take it up for a minute. First and second question, any kind of questions you can ask me now. First and second question, which qualification, which courses suits us? Anyone have any questions on this too? You can ask. So I'm open for questions. Anyone have any questions about first and second question? You can ask me. Is my voice audible? I hope so. Okay. So I think people are saying no questions. Thank you. I don't think so there are any questions for this one or two questions. Let me take the third question. So now third question, what is the difference between online and offline? See here, online and offline, what is the difference and how this is going to be run this courses is online. You'll have a trainers and late evenings are the sessions. Online sessions, late evenings. Okay. And offline, morning 10 to 12 p.m. Okay. So classes will be for 1 hour. So 1 hour duration, and duration will be around 3 to 4 months. Perfect. Now, what is the difference? Basic difference is only one thing, that you will have more of group discussions in offline, more of debates in offline, more of exams in offline. Online, you might have less discussions. Online, you might have less exams, but the syllabus, the LMS access, everything will be same. But if you want to grow your communication skills, if you want to become more perfect in your stage fear and facing the interviews and all, you can come for offline classes. So offline classes, most of people suits because they come to class and they teach, they learn, they meet people and they continue the learning. But both online and offline, both people will be given soft copy materials and LMS and exams and certificates. Everything will be given. Everything will be given. So there is nothing that you have to be worried. So everything will be given. There is no little difference, but online, there will be different trainers. Online, I'll take 1 or 2 days classes, but offline, I'll take all the regular classes. And classes will be from Monday, Tuesday, Wednesday, Thursday, or sometimes Monday, Tuesday, Wednesday. Thursday will be exam, and Friday will be mock interview. Saturday will be your industry expert sessions. So this is about your difference between online and offline. Next question. Shall I join the course if I have experience? So answer is yes, but your experience might not be considered for clinical research jobs unless and until you are in particularly in clinical research activities. Like say, for example, there was one student who is currently working in one company and she wants to learn here. So that's why she took admission and she is learning now and she wants to apply for the jobs. Only for jobs, for applying jobs, she took admission in Clinosol. So this is something which we can always have it. So you can join the course. If you have experience, you don't need to worry. And you can further discuss about the other aspects. Now, next question, is there an installment for the fee payment? Yes, there will be two installments. There will be two installments will be given. And if you pay one-time payment, fees will be less. Fees will be less. And online classes, fees will be less. And offline, fees will be more. Okay. And coming back to fees, fees will be calculated based on number of courses, 3 course, 4 course, 5 course combination or single course. Depends on online or offline. And also depends on one-time or two-time payment, and also spot admissions or not spot admissions. All these things will be given in paper, a written format. So you don't need to worry about this all things. I hope so. Everyone knows about the fee structure, but if you don't know the fee structure, I'll just check it out, the fee structure, and I'll show how the fees is been developed. Yeah, so this slide is competitor analysis, and I'll explain about the fee structure now. So fee structure is been given as here like this, and this is final fees. So till 1st September, till today, the fees for 3 course combination is 20,000 for one-time payment, and for two-time payment, it is 22,000 for online. For offline, it is 25,000 one time and 27,000 it is two times. Course combo 2, which is 4 course, 23,000 online for single time payment until September 1st. And if it is two times, it's 25,000. Offline, it is 28,000 and 30,000. So which is 4 course combination. And then 5 course combination, 26,000 online, one-time payment, 28,000 two-time payment from tomorrow, 30,000 offline and 32,000 offline for two-time payment. And if you want to go for course combo of 4, which is 5 courses, I think CR, CDM, PV, medical writing and regulatory affairs and SAS, online it is 30,000 and two-time payment 32,000. Offline it is 37,000 till today, and tomorrow it will be 37,000. And if you want to take any individual courses, you have to pay 13,000. Single individual course, only if you take, it is 13,000. And there are group discounts also. Already we have discussed about this. If you come in 3 students, it will be 10%. If you come 4 students, it will be 12%. If you come 5 students, it will be 15%. And if you have more than 90%, then 20% discount. If you have more than 85%, it is 15% discount. And if you have more than 80%, it is 10% discount. And there will be referral programs also. 2 students, if you refer, 20% discount for that particular student. And if you refer 3 students, 25% fees discount, and 4 students, more than 4 students, it is 30% student fee discount will be given. And if your college is having any MOU, it will be 10% fees reduction in your student fees. But any of this 4, you can use only one. You can't come and say that, sir, I have my graduation 85% and I also have my college MOU. I also have referral. I also have group student discounts. I think we will not be considering that. So this is the fee structure. You can pay 2 times installments in the fees. So this is the next question, which is your fees. Okay, so what is the best course suits for me? B.Pharm, M.Pharm, PharmD, nursing, dental, and Ayurvedic or physiotherapy, CR, CDM, PV. And any PGs, medical writing will be added advantage. Any statisticians, SAS will be added advantage for you. So all these courses, BSc, MSc, CR, CDM, and regulatory affairs. Now, what type of internship or practical experience will be given? So first one, internships, 100% guaranteed internship, 100%, no doubt about it. So you can make a note, 100% guaranteed internships, because we have collaboration with 4-5 SMOs as CRC interns. And sometimes they give payment, sometimes they don't give payment. And practical exposure, assignment based. Assignment based learning will be there. So, like for example, protocol development and ICF development, like that. This will be the practical assignments which will be taken into consideration. So I think practical experiences and internships both can be given. So what are the career prospect after completing of the course? You can become a CRC or CRA or TMF or CDM or validation specialist or CSV or medical writer or regulatory authorities or DSA, signal management or risk management plans. All these people are project manager or TMF. All these roles can be worked with your courses, and we will be referring you for the interviews. Okay, how do you assess for the job placements? See, job placements assistance will be based on last come first serve, last come and first serve. So what is this mean is the older students will be given first preference and newer students will be given later preference. So 2 months of training, once it is completed, we will add you into career page or add you into career WhatsApp groups. And first thing, we give training on career pages, LinkedIn, and also direct HRs from Clinosol, and resume writing and mock interviews and aptitude and interview based questions. All this will be given. So placement assistance will be guaranteed, no doubt about it. So end of the day, end of the course, there will be a course certification which will be given, PG Diploma in Clinical Research, CR, CDM, and PV. So this certificate will be given. Letter of recommendation will be given. LOR will be given. And verification will be completed by us. Verification will be completed by us. And internship certificate also will be given. So all the questions I have answered. I'll repeat all the questions. The first question you have asked is who can take this course? BPharm, MPharm, PharmD, BSc, MSc, and nursing, BPT, and medical and dental. How do I know which course is right choice? Operation, CDM, PV, medical writing, SAS, and regulatory affairs. What is the difference between online? Online late evenings, offline 10 to 12, and 1 hour duration, 3 to 4 months, and soft copy materials, LMS, everything will be given to the online as well as offline. Shall I join the course if you have experience but might not be considered as clinical research jobs unless and until it is relevant job? And is there installments available? Yes, 2 installment will be given. One-time payment fees will be less, and online classes fees will be less, and offline classes will be more. So what are the best courses for me? So already have explained what are the different best courses you have and what type of internship and practical experience. Internship based on CRC interns and also agreement based on assignments based on learning, protocol development, and ICF. What are the career perspective? CRC, CRA, TMF, and trial data managers and clinical data managers, visualization, CSVs, science, RMPs, and also PMPs. All those things will come into your career perspective after you are completing the course. How do you assess job? Last come first serve, 2 months of training and added into career pages. Till 1 year you will have in career pages. You can apply and we will also support your resume. So last question, what was the certification provided at the end? PG Diploma in Clinical Research, CDM and PV and medical writing, LOR and letter of recommendation and stamps and everything will be given to the students. So I think I have answered all the 10 questions, but Now I'm open for any more questions you have. I'll ask my team to post this question in chat box. You don't need to worry. My team will be posting the questions in the chat box or in Alumni Networking or in your September batch. So I hope I have answered almost all the questions, but I'm open for questions. Any kind of questions, please do let me know. I'll be able to answer the questions. Sir, any chance getting offline recording classes for online students? No. Sir, get discussion during offline classes. It is helpful for us to understanding many things. See, we don't record offline classes, but you can take information from them that what classes are going on. So that's one thing, Arpita. Perfect. Any more questions? Thank you, Arpita, for asking the question. Any more questions? I hope I have cleared most of questions. Today we will be taking admissions and hopefully the sessions will be starting from tomorrow, which is September 2nd. So tomorrow or day after tomorrow, because it's still raining. So might be people are having some issues with internet and all. So we might have the sessions tomorrow or day after tomorrow. So, but I'm open for questions. Any kind of questions, if you have, you can ask me. I'll be able to answer.